Ni hao, and welcome to episode 13 of my Maoist China vlog. And this episode is part of the social and cultural change topic, and we're looking at health and education provision. Within this specification of the EdXL A level, and these two social and cultural changes come together, education and health, and they are part of this topic which looks at change all the way from 1949 to 1976. And therefore, as I said last time, the essay questions do tend to reflect upon success or failure, change or continuity across that time span. And perhaps also of comparison between different changes. So the status of women, education, health, religion, and cultural change might all be seen together. And also, as I said last time, there tends to be a common pattern with these social and cultural changes, and that is that things were pretty poor before the Civil War, not surprisingly, given China's circumstances before that in the war and in the Civil War back into the 30s, and even the chaos before that in the 20s. But then things improve in the 50s under Mao's early leadership, and then tend to kind of be either unravel or at least take a hit during the Cultural Revolution. So let's talk about education first of all. Before 1949, education provision in China as a whole was poor. In fact, 45% of males had some schooling, and those males tended to have about 4 years of schooling if they went. Only 2% of girls had some schooling, and those girls also had less schooling than the boys. If they went on average, they went for 3 years. 80% of the population of China were illiterate. And the education that was provided on classical Confucian precepts. This idea of hierarchy and of knowing your place and of not of searching for harmony within society, not a bad thing in itself, but what it would not lead to is entrepreneurial skills of change or modernization. Modern subjects such as maths and science weren't even included in the curriculum. And to cap all of that off, the education that was provided was not free either. So fees and entrance exams meant that the poor and even probably the middle class were much less likely to get an education. The Communist Party acted enthusiastically against this and quite successfully against this, I have to say. They introduced a national primary school system for the first time. Between 1949 and 1957, the number of primary school children rose from 26 million to 64 million, almost trebling. And the introduction of pinyin in 1958 really helped with literacy rates. Pinyin was a simplification of the Chinese written language. So Chinese or Mandarin back before then was didn't have letters or words. They had what were called ideograms, kind of pictograms. But a chap called Zhou Yuguang, let's say it like that. His name is spelled Zhou, and his first name is spelled Youguang. He and some others were put to task to make a simplified, straightforward phonetic system which could be understood and easily absorbed by more people. And that's a system of pinyin which has transformed Chinese literacy rates. So that, as I said, there were 20% of the population were literate in 1949. That had risen to half by 1960. And then 64%, almost two-thirds, by 1964. Quite like that, 64% in 1964. And then up to 70% in 1976, perhaps kind of slowing up by then because of the impact of the Cultural Revolution rather than anything to say bad about the last few people that couldn't read, or the last third of people that couldn't read. To help with this, not just children were given education, but also winter schools were provided for adults, particularly peasants. The Communist Party said that 42 million peasants attended those winter schools in 1951-52, and that would happen in winter, and then the next winter you'd go back and get refresher. And universities were established to try and make up for the lack of scientists, doctors, engineers, technical experts in the country, and lots of young people were sent initially to the Soviet Union to train there and then to come back and train others. So education takes a big step forward, But it's fair to say that there is an effectiveness, a question mark over the effectiveness of these policies. Winter schools, for instance, peasants tended to forget a lot of their teaching between one winter and the next. And it's kind of, I guess, like a use it or lose it scenario for them. Education was also really underfunded. Only 6.5% of the budget in 1962 went on education. 1952, that is, 6.5% in 1952. So that and that's because of the impact of the Korean War, actually. But anyway, despite the growth that we've talked about in primary school population, still less than half of the 7 to 16-year-olds in the country were in school in 1956. And the system was still quite elitist. Key schools were set up and they had entrance exams, and the brightest students, of course, went there, or those who were children of Communist Party officials. In rural schools, in particular, standards of education were really low. Teachers there often were only just a little bit more educated than the children, and therefore struggling to stay ahead. Education was also really impacted by the Cultural Revolution. In many ways, it just simply stopped during the Cultural Revolution, and it's figured that up to 130 million students at that time got no education at all. Many of them joined the Red Guards, campaigning against the Four Olds, which had a knock-on impact upon education, because teachers were persecuted, many of them were killed, books were destroyed, and children then spread out. And then later on, those students were sent up to the mountains and down to the villages, out into the rural areas where, again, they received no education at that time either. A census compiled in 1982, 6 years after Mao's death, said that less than 1% of the population at that time had a university degree. Only 11% had got schooling after the age of 16. Only a quarter had received schooling between the ages of 12 and 16, secondary education, and only 35%, only just over a third, had received schooling up to the age of 12. And remember that if you were 18 in 1976, you'd be 24 by then. So that's kind of like the Cultural Revolution generation, the lost generation, as they're often called in China. So education, to sum it up, education was poor before 1949, definitely improved, and good statistics, particularly for literacy rates growing. But the broader picture would have to be seen as being only partially effective because of the great damage done by the Cultural Revolution, kind of a lost opportunity, really. Healthcare, similarly, very poor and patchy before 1949, and actually both health and education much better, of course, in urban areas and in the east of China, along the seacoast, where those more developed areas are, and much more patchy and likely to be less well provided for in the rural areas where things are less developed all round, less economically developed, and less infrastructure too. Mao's policies, again, in healthcare were fairly effective. Patriotic health movements were introduced to try and educate the poor and rural areas on basic matters of health, catching rats and mosquitoes, for example, digging deeper wells to make sure the water was clean, not using human excrement as fertilizer, those sort of basic things that we're all kind of aware of. Villagers were encouraged to drain swamps where malaria-infested mosquitoes thrived. And all this had a big impact upon the health of China. Smallpox, cholera, typhus, plague, and leprosy all practically eliminated. And anti-drug campaigns also reduced the sale and use of opium as well, which is a sort of self-inflicted health crisis. In the Cultural Revolution, a good thing about the Cultural Revolution coming up, barefoot doctors were introduced. These were students who would go out to the villages with a modicum of health training, 6 months training in medical matters, really kind of focusing on, again, improving hygiene and stopping the spread of disease, providing advice about contraception, rather than trying to solve everything. In the 1950s, large numbers of Chinese were treated by a qualified doctor for the first time. So that's big news. By 1973, over 1 million new doctors had been trained under the Barefoot Doctor Scheme, and 90% of villages were involved in that scheme by 1976. It was such a successful campaign that it inspired the World Health Organization to try similar schemes. It should be said as well that the communes that were so disastrous for agriculture in the Great Leap Forward also established the idea of medical clinics and again provided wider healthcare provisions for the Chinese population. All this meant that there were 25,000 new doctors graduating each year by the 1960s. The number of doctors had risen to 150,000 in 1965. That's actually qualified professional doctors rather than barefoot doctors who had had their 6 months basic education. And all this meant that life expectancy rose from a pitiful 36 in 1949 to 57 in 1957 and 62 by 1970. Although if I was going to pick holes in that, I would say 36 in 1949 probably is impacted on it by having had 4 years of civil war preceded by 7 or 8 years of war against the Japanese in China as well. There are other limitations to the healthcare agenda. Doctors were attacked in the anti movements in the 1950s, and many were sent to the Laogai, reducing provision. Spending on healthcare never rose above 2.6% of the state budget up to 1956. So again, it's those early kind of critical years of the PRC. Healthcare spending was low. And it also should be said, as I said earlier, that urban healthcare was much better. So there were over 800 Western type hospitals built, but those are almost all in cities serving the urban population. The rural population healthcare lags a long way behind, hence the need for those barefoot doctors. Doctors were also attacked in the Cultural Revolution, and during that time, some doctors actually stopped using painkillers as a sign of revolutionary progress. Yeah, we can beat this even without painkillers. So overall, as I said, healthcare, you'd have to say that like education, healthcare starts at a very low base and it is improved by the policies that Mao brings in. But like healthcare, education suffers from some of those policies too. And in particular, the attacks made in the Cultural Revolution mean that the progress is neither smooth nor regular. That's the same thing. Neither smooth nor continuous. And by the end, they have improved. But again, you'd probably say it's a missed opportunity to really change China completely. I hope that helps. And I'll see you next time where we think about cultural change and religion.